So you are doing DAT and there is IAT. What is the difference between these two? So forget about the definition. I know the meaning, like direct. What does it mean to say direct? Because the difference is I and D. Do you understand me? AT is constant, antiglobulin test. Why do we say indirect and why do we say direct? Now, when you say you are doing something direct, you know when you do blood grouping, you put antisera, right?
Yes, sir.
So that antisera, stay with me, just stay with me. That antisera is commercially prepared antibody. That's what it means. Is antibody. That antisera, you say antisera A, antisera. That sera is like serum. Do you get? So it's commercially prepared. It's commercially prepared antibody. Stay with me. It's commercially prepared antibody, because if you claim to know antibody panel, you must know what you are measuring. Just in case there's a follow-up question, there are a few things I want to give you here. Then I will just teach you what you want me to teach and go. So when you say antisera, it's commercially prepared antibody. So you see somebody that has blood group A. Are you getting me? That person has antibody B, remember? So that your yellowish antisera B is a commercially prepared antibody B. Do you understand?
Yes, sir.
So when somebody is blood group A, blood group B, the person has antibody A. That your bluish antisera A you are seeing is commercially prepared antibody A. The same thing with anti-D, Sarah, okay?
Yes, sir.
Stay with me. So when you now put that antisera, okay, you are trying to use that antisera. That antisera is not what you want to detect is not on the antisera. Are you following me? In fact, the antisera is a known material. Do you get the point? It's known. We know what is there, but we don't know what is on the patient sample. So what we are going to do that we will now drop the patient red blood cell on the antiseras, right?
Yeah.
So that means what you want to measure is what is on the red blood cells. Now stay with me. So when you now do that, if the thing reacts on A, what it means that the person has antigen A. Are you following me?
Yes.
That antisera A is commercially prepared antibody A. So it's trying to tell that this A antibody is specific to the A antigen on the red blood cell. That's why you can say it. That's why it's a reaction. That's what it means. Okay? And it goes on with B and D. Now, having said this then, what that means is this. When we do that antisera, all of those things, there is also another way we can do blood group. I'm trying to tell you what DAT and IAT means. Don't think I'm telling you blood group. But the point I want to make is that from that antisera, what we're determining is the antigen. That's what I'm trying to say here. Okay? Now, what if, do you understand what I said so far?
Yes, sir.
So what if we decide, you know what? Let us get a known, that antisera is a known antibody commercially prepared antibody. So let us say, okay, you know what? Let us get a known A cell. Are you following me?
Yes.
A known B. That means we'll get somebody that is blood group A. We'll get someone that is blood group B. We'll get their red blood cell. We know that their red blood cell, this blood group A has antigen A. This blood group B has, are you getting me? Antigen B. So when we get it, those A cell and B cell is what we know, is a known cell. We know that this is group A, this is group B, this one has antigen A, this one has antigen B. Does that make sense?
Yes, sir.
Let's say we'll get a patient. Instead of using the patient red blood cell, we decide to spin the sample down and use the patient plasma. You following me now?
Yes.
So what we are going to do, we now put I'm just trying to tell you another thing. We can now decide, you know what, this A cell, we'll put it on a tie.
Yes.
This cell, we'll put it on another tie. We'll now carry the patient plasma and put on the A cell. Patient plasma on B cell. Are you getting me? And rock it. What you are trying to detect is the antibody now in the patient plasma. Are you following?
Yes.
So when you say that somebody is blood group B, the person is going to have antibody A. That antibody A will now react with that A antigen. Are you following me?
Yes, sir.
So basically what I'm trying to say is this. That is why in blood bank, we call it, when we do the tie group you guys do commonly, that one is forward group. That forward group is that you are detecting the antigens that is on the surface of the red blood cells. Are you following me?
Yes, sir.
When you now use a non-A or B cells to detect the antibody in the patient plasma, that is reverse grouping. Do you understand?
Yes.
So when we detect the antigens on the surface of the red blood cell, that is forward grouping. That also can be seen as direct grouping. Okay. So when we do when we use A cells and B cells and detect the antibody in the plasma, that can be reverse grouping. That can also be called indirect grouping. Are you following me?
Yes, sir. Yes, sir.
So what it means that when we say direct antiglobulin test, the difference is the location of what we are looking for. So when we say direct, the antibody we are measuring is on the surface of the red blood cells.
Yes, sir.
When we say indirect, the antibody we are measuring is in the plasma.
Okay.
That's just why I went that route. Does that make sense?
Yes, sir.
So when you hear something, and I'm saying this because of the things you say you are prepared, I don't know the one whether this will benefit you. That's how I am. Okay. So now, sometimes when we, not sometimes, so when you hear something like hemolytic disease of the newborn, what you are saying is that there is a hemolysis associated with the newborn baby. And in most cases, among many other tests, but significantly in most cases, the woman has developed antibody. Are you getting me?
Yes,
and that antibody has passed from the woman to the baby. And that antibody attach on the baby's red cells and begin to cause hemolysis. Does that make sense what I just said?
Yes, sir.
That hemolysis that is causing at that time, that antibody that is causing it, where is the antibody? On the plasma, sorry, on the red cells, right?
Yeah.
The process in which we can detect the antibody that is on that red blood cell is called direct antiglobulin test. Because the baby's immune system at that time is not even enough for the baby to develop antibody that can be seen in the plasma. A newborn baby, you can't see any antibody in the plasma. The immune system is not yet strong. Do you get the point?
Yes, sir.
Yes. In fact, a newborn baby, if a newborn baby is blood group A, you can't see anti-B in the plasma. If a newborn baby is blood group B, you can't see anti-A. If the person is blood group O, you can't see antibody A. The person doesn't have antibodies in the plasma because he's a newborn baby. The system, in fact, depending on how you look at it, the blood group of the system, this might be too much for you, but sometimes the processes involved for the whole system of that blood grouping to form very well, the person's immune system still have a long way to go to complete that processes. It is only when that process is completed that the person can now begin to, are you getting me?
Yes.
Antibody. Okay, that's also what I'm trying to say, that when it comes to antibody, when we measure the antibodies on the surface of the red blood cell, that's DAT. So we look at the antibody in the plasma.
No, that's indirect.
The 80.
Yeah.
That's just why I mentioned that. Okay. Now I took my time to look at it. They say panel practice. Here is your chance to show how much you remember. So they gave you panel 1. Now there is something I don't want you to be confused. That's why I'm teaching you this. It's not the answer. Your answer, I have it already. And I already know why they excluded S. So what antibodies? Can you see? Antibody bracket then IES. He's saying there can be one antibody. There may be more than one antibody. Is or are what? Present. So I want you to take note of that. Number 2, what antibody something is are then not what? Eliminated. Do you get the point? So don't be shallow in your answer where possible if they allow you to write more. I think my this has moved. If they allow you to write more. But let's look at what you gave to me. Okay?
Yes.
Are you following so far though?
Yes, I am.
Good. All right. Let's look at what you gave to me. I'll try to pick something quickly. Because you've listened to the panel on my distance, so that may not be a problem. But I want us to, there is some things I want us to answer first. What do we even mean? Forget about the result. Just leave the result alone. This is not my problem. But as soon as I got this, the first thing that got my mind was Salis. That's what we call it. Then Lis. Then AGH. Are you following me?
Yes.
Under this list, you can still say that it is saying that it is 37 degree. Are you getting me?
Yes.
Now, so I asked myself, what do you know it is Salis? And what do you know it is Lis? And what do you know it is? Maybe AGH, you know AGH, don't you?
Yes.
You just want to say now anti-globulin.
Yes.
Okay, good. So that's AGH, okay, anti-globulin. So IgG, which is another thing I want to show you quickly. When we say antibody panel, what we are looking at is IgG, not IgM. We say blood group A, antigen B, antibody. Those ones are IgM. All those antibody A, antibody B, or antigen A or antigen B, they are what? IgM. I'm saying that this IgM in blood bank, even if you make mistake with IgG, is not life costly. It doesn't cost much. Are you getting me? It's not life threatening, to be honest. Like my manager was always going to say, you will be unlucky. Do you get the point?
Yeah.
You'll be unlucky for IgG incompatibility to kill somebody. The reason I'm saying this, I don't know what they will ask you. I hope you are making note of what I'm saying, just in case if you've not listened to it on my video. Now, this IgG we are going to talk about now, which is antibody panel, what they when there is incompatibility, what it can cause is what? Extravascular hemolysis. Do you get the point?
Yes.
But that one that is IgM, its own hemolysis is what? Intra. It punches the red cells. Are you getting me?
Yes.
And if you don't find out on time, it can lead to death. So what is Salis? So when you look at that, you're talking about single antigen expression. Single antigen expression. That's what I just want to teach you. It's not your question I'm after. So, because when I heard that, this is where you're going to say, okay, what if there's a follow-up question? We are busy learning antibody. Are you getting me?
Yes, sir.
So single from the word single antigen, there's what we call HLA. I don't know if you've watched my video on HLA, okay? But HLA means human leukocytic antigens. Please take note of all this I'm saying.
Yes, I am.
So human leukocytic antigens, that's what it means. Now, what does it really mean to say human leukocytic antigen? Now, let me explain something to you. In fact, some antibody panel, which I'm sure, if you go back to those, my antibody part 1, part 2, I don't know, whatever, you are going to see that some of the antibody panel I'm showing you, you will see HLA there. Sometimes you see COB there. These are different antigens. I'm trying to tell you that even the antibody panel you are learning today, I hope to make you to understand the antibody more than what you think you understood.
Yes, sir.
So now what I'm saying is this. Once you know this HLA, let me explain it first. You know, when you separate your blood, you know the way you separate your blood, you have plasma, you have buffy coat, you have red blood cells, right?
Yes, sir.
Stay with me. So you will see that if you put it in terms of percentage, the plasma is going to be high, followed by red blood cells. The buffy coat is just little.
Yes, sir.
That buffy coat is where you can find platelets and what? White blood cells. Even in the lab, when you are separating the plasma, a good biomedical scientist will not go far. Are you getting me? Because by the time you are getting there, you should have enough to process your sample. In most cases, anyway. I don't mean when the sample is insufficient. Do you get the point? Okay. Yeah. So what did they mean that when somebody donates blood, the blood, once the blood is donated as a whole blood, they will separate it into different components. Okay?
Yes, sir.
So when they develop it into different components, you are going to get red blood cells, you are going to get plasma, you are going to get platelets. Of course, you are going to get white blood cells. Are you following me?
Yes.
That red blood cells, think about the centrifuge now. So you centrifuge it. For the plasma, it is easy for us to get amount we want without even touching the buffy coat. Are you
Yes.
following me? But when it comes to the platelets, how do you even want to separate platelet without touching white blood cells? Because two of them are just little.
Start together, yeah.
Are you getting me? So in
Yeah.
most cases, when you are separating platelet, there can be significant introduction of what? White blood cells. Okay?
Yes, sir.
Again, when we are separating the red blood cells, sometimes we can also introduce white blood cells there. Are you getting me?
Yeah.
So that antigen of the white blood cells that has been introduced in the platelets or in the red blood cell is human leukocyte. Are you following me? Leukocytic antigen. That means human white blood cell what? Antigen. Are you following me?
Yes, sir.
So I'm trying to explain this to you. So what that means then is that if someone is healthy, okay, so someone that don't have any problem, just that the person need blood, even a pregnant woman self, that even if the immune system has depleted, but the immune system is still strong, if you give the person blood, if you give platelets, that platelet you're giving to that person has some percentage of what? White blood cells. That red blood cell you give to that person has some level of what? White blood cells. Are you following me?
Yes.
So when you transfuse that platelet or red blood cell, the person's immune system will go and bind those white cells and destroy them. Are you getting me?
Yeah.
However, if you get someone that is immunocompromised, like in a case of leukemia, are you getting me?
Yes, sir.
In those immunocompromised patients, the immune system is so weak that it cannot bind those white cells. Are you following me?
Yes, sir.
And if it doesn't bind those white blood cells, do you know what the white blood cell will do? They begin to multiply, proliferate. And they will multiply to the point that they will now want to chase the landlord. Are you getting me?
Yes.
That white cell was a tenant because it came by introduction. Are you getting me? So the too much multiplication, what it can now do then is to begin to mount an attack on what? On the patient. Do you get the point?
Yes, sir.
And that can lead to more complicated issue. And when that thing happened, you will see that attack was based on transfusion. And that attack was based on the person's condition. If the person was not in that condition, that would have been taken care of. Are you following me?
Yes, sir.
And that is what we call graft versus host disease. Okay. So what that means then is that in order to prevent that graft versus host disease, okay, I'm rushing. There's something I missed first. So when that HLA is introduced in the person's system, because it is antigen, are you getting me?
Yeah.
That incompatibility will now make the person to begin to see how it can develop what? Antibody of HLA. Does that make sense? And I'm saying because of how immunocompromised that person is, it can become even more challenging. Do you get the point?
Yes, sir.
So what we now do is that in such situation, we can now apply what we call irradiated. We'll put a radio light on the red cells. I'm sure you must have seen it on my videos, okay? Irradiated blood. So we'll pass the blood on that UV radio light. So that radio light will then inactivate those leukocytes antigens.
They are coming to fight the...
Yeah, before you even go to the patient. So as a blood, in the blood bag, after we separated platelet, we'll now use radio light to inactivate those white cells that is there. Do you understand what I'm trying to say?
Yes, sir.
So again, just in case if you see a question, the reason why we are putting that radio light is to prevent that attack that could come from that human leukocytic antigen, foreign human leukocytic antigen. Do you get? Therefore, why we do irradiated blood product is to prevent graft versus host disease. Are you getting me?
Yes.
Now, in some cases, when the person's immune system is somewhat deteriorated, even though you pass it through radio light, it is not all the white cells you may kill. But the percentage of what is left may not be so much active to be able to do anything. Do you get the point?
Yes, sir.
So what we're going to do, when somebody's immune system is so down, what we can do that we go further. We can do what we call HLA matched. So HLA matched, that since we know that there can be differences in human leukocytic antigen. We say, okay, Mr. A need blood, and Mr. A's immune system is very down. You know what? Send us Mr. A sample. Let us do phenotype of the leukocyte of the Mr. A. I'm trying to explain SALIS for you.
Yeah.
So let us do the phenotype of Mr. A on the leukocyte, not red blood cells now. The leukocyte. So by the time we now see the antigens that are present on that Mr. A, are you getting me?
Yes.
We now see from our banking the donor that has a similar antigen. You understand the point? Okay.
Yeah.
Then when we get such a person, we cannot cross-match the person's sample with this Mr. A. If it is compatible, what we are going to do is that anytime Mr. A needs sample, we must get those donors that has a similar antigen. Do you understand?
Yes, sir.
So again, HLA match is to prevent graft versus disease. Okay, I'm saying that the SALIS, what is trying to determine is to show you, if present, those are specific antigens that are associated with HLA. That's what I'm trying to say. Does that make sense?
Yes, sir.
You know, in microbiology, we have what we call selective media. So this is a selective.
Okay.
Are you following me?
Yes, sir.
This will now lead me to another thing I want to say. These antibodies you say you identify, you see these antibodies here, this D, C, E, are you getting me?
Yes.
All these things, they are not antibodies. You are the one that said it's antibody. This is why people don't know antibody panel. Are you following me?
Yes,
What
sir.
is antibody is this? Do you get?
Yes.
This result is an antibody.
Antibody.
These ones are not antibodies.
What are they then?
That's why I know that. That's why I'm telling you this. That's why I told you about blood grouping when I was teaching you. It's still the same thing. So these are antigens. They are IgG antigens.
Okay.
That's why I started with HLA. So this HLA, we're going to check. That means there are different HLA antigens. Human leukocytic what? Antigens. Do you get the point?
Yes, sir.
So in that human leukocytic antigen, if there is a differences in the human leukocytic antigen in terms of blood bank, the person will develop human leukocytic antibody. And are you getting me? So it takes a foreign antigen to stimulate production of antibody. Are you following me?
Yes, sir.
In basic immunology, once there is antibody, there was an antigen. Let me repeat. In basic immunology, antibody means there was, I didn't say there is, there was antigen. So when you go for immunization, what we are immunizing with is antigen so that you can develop antibody.
Yeah.
So I'm saying that this patient result you are seeing here is the antibody. But this thing you are seeing here, they are
antigens.
So if you look at this, it's saying 1 up to what? 11. These are cells. So cell 1, cell 2. You can see number of cells. Can you not see it here?
Yes.
So these are red blood cells. Are you following me? So
yes,
this is D antigen, C antigen, E antigen, little c antigen, and so on. So when the person plasma react with D, we now know that it will take anti-D for it to react with D antigen. Do you understand what I just said?
Yes.
If somebody become anti-K, we now know that, okay, it means that in the plasma, what we have is antibody K. That was why the antibody K was able to react with what? Antigen K. So what it then means is that if somebody develop antibody, if I identify anti-D now, what it means that the person does not have antigen D.
Yeah.
Did you understand what I said?
Yes, sir.
Because for somebody to develop antibody, the person does not have the antigen. The antigen was foreign for the person to develop the antibody. So when I do antibody panel and I identify anti-D, it means the person doesn't have antigen D. Now let's do it this way. When you say blood group A positive, blood group A negative, what you are saying that blood group A positive. That thing you guys call resource positive is D antigen positive. So when you say that someone is blood group A negative, you are saying the person does not have the D antigen. But the one that is blood group A positive has what? D antigen. Are you following me now? Let me explain what I'm trying to say here.
Yes,
when you say A positive, when you say B positive, when you say AB positive, when you say O positive, even though it is a different blood group, are you getting me? Even though the IgM, are you following me, is different. For the fact they are all positive, that means that blood group A positive, B positive, AB positive, O positive, all of them has what? D antigen. And that D antigen is IgG, immunoglobulin G antigen. Are you following me?
Yes, sir.
Why blood group A may have IgMA, blood group B is IgM antigen B. Are you getting me? Blood group AB, antigen A and B. Blood group O, no of that antigen. Do you understand the point? But for the fact they are all positive, they have that D antigen all true. So what it means that if someone is blood group O negative or A negative, okay, let's stay with one blood group. Let's say somebody is blood group O negative. If you give the person blood group O positive, do you understand now?
Yes.
Because the person that is O negative does not have D antigen, but you are giving the person O positive that has what? D antigen. That person will then develop anti-D. Does that make sense?
Yes.
So what that means is that even though that theoretically the blood group is compatible, somebody that is blood group O negative can receive blood group O positive because two of them does not have any antigen, right? But the difference in that D antigen is why it's not compatible. Because the person will develop anti-D. Are you following me?
Yes, sir.
You know why I'm saying this? If D antigen can be found in blood group A, can be found in blood group B, can be found in blood group AB, can be found in blood group O, what it means is that IgG antigens does not have any respect of the blood group A. Do you understand? I'm saying that this antigen C can be seen in blood group A, can be seen in blood group B, can be seen in blood group AB, can be seen in blood group O. So when it comes to IgG antigens, it's not a respect of blood group. Do you understand me? So the thing that is respect of blood group in determining the blood group are IgM. And let me also add another layer before I go straight. So if we are going to determine that process of determining the IgG antigens that are on the surface of the red blood cells are called phenotype. Do you understand?
Yes, sir.
So phenotype is a means in which we are able to type the different IgG antigens seen on the blood cells. Now, before I continue, there's something I forgot to mention on this one, but I'm sure you must have heard it. Antigens are found on the surface of the cells. Antibodies are found in the plasma. That is why when a newborn baby, we suspect hemolysis due to antibody, we know we cannot detect that antibody in the plasma. We now use another means where we can detect the antibody on the cells. Are you following me?
Yes,
it does not, yes, that antibody is coming from somewhere to bind. It's not technically, it's not like the baby has the antibody. Are you getting me? It's the fact that the antibody is binding on the surface of that red blood cell. But I'm saying that all things being equal, when somebody develops antibody, that antibody will be found in the plasma. Antigens are found on the surface of the red blood cell, cells. Okay, so in red blood cell you have these antigens. Okay.
Yes.
Any question?
No, sir.
Good. So once we understood this now, it will now make sense why when we identify antibody, we say, it means the person does not have the antigen. And this is where people don't understand antibody panel. If you understand what I just said now, most of these antibody lectures, you will know what it means. It's not about identifying it. It means it actually is about what does it mean now we've identified the antibody. Do you get the point?
Yes, sir.
Look at this AC here. That's what I'm actually trying to explain. Can you see the AC?
Do
you know what AC means? Do you know what it means?
Like the control.
Yes, this is auto
Control. Okay.
control. So what we have done here, we have cell 1 to 11. So what we'll do that in cell 1, we'll add the patient plasma. In cell 2, we have the patient plasma. In cell 3, are you getting me? I'm
Yes.
sure you must have heard me explain it on my video.
Yes.
So when it comes to auto, we are going to use the patient cell against its own plasma.
To see if there will be a reaction.
And if there is a reaction, it's become auto antibody.
Okay.
Do you understand me?
Yes, sir.
You become auto. So there are two types of antibody you can detect in this kind of either allo antibody. Allo antibody is the one they acquire. Okay. The auto is when the self begin to fight its own self. Does that make sense?
Yes.
All right. I think I've given you this background. So phenotype is so meaning when you identify, because what people don't understand is that they don't understand when people identify antibody, it means the person does not have the antigen. Once you understand that, it will help you. When you are looking at ABO compatibility, if they ask you, for example, in your exam, which blood will you give, whatever, are you getting me?
Yes, sir.
Think about antigen. Don't think about antibody. Let me put it this way. If they say which blood, think about antigen. Because I've just told you that when we collect blood, we'll separate it into different components. So when we say blood, what we're talking about red blood cells. And in that red blood cell, what you're going to see is antigens, not antibody. Do you understand the point? Now, but when we say which blood group will you give okay, so maybe if we say someone is blood group A and you want to give the person FFP or cryoprecipitate or platelet, which blood group will you give? For the fact we are mentioning what you will give in FFP or cryo or platelet, stop thinking about antigen, think about what? Antibody. What I mean that if they say, what blood group can you give someone that is blood group A? What blood can you give someone that is blood group A? Think about, okay, someone that is blood group A has antigen A. So any blood I must give must be the one that has the same antigen A. Are you getting me? So you think like that. If they say, what blood group of the FFP can you give someone that is blood group A? So, okay, someone that is blood group A has antibody A, antibody B. So any FFP I will give must be the one that has that anti-B or doesn't have antibody at all. Do you get the point?
Yes, sir.
So that's how you should think, because these are kept into different components. There are other things okay, let me add another layer here before I move on. Remember that platelet is thrombocyte, is cells, is not plasma. So ideally, we should not be talking about antibody in platelet because it's a cell. There is a cell like white cells and red blood cells.
Oh.
Is it not correct?
Yes, sir.
But why do we always mention about antibody when we talk about platelet? I'll tell you the reason. The reason is this: if you leave platelet without it floating, it will fall aggregate. It will be activated. It will fall clump. You know, like platelet clumping. It will start clump. So in order to prevent it from clumping, we'll mix it with what? Plasma. And start using it, because the plasma now will help to now keep floating the cells. Are you getting the point? It will keep floating the cells. So it is the presence of that plasma that is in the platelet. That's what we consider
antibody. All
right. I think that's all I want to say. Let's do this. You said there's no question.
No.
There's something I'm going to teach you. Let's do what I've told you already. Then we will then I'll show you another thing, which in most cases I didn't mention on my video, by the way. Okay. So now, because here is 0, are you getting me?
Yes.
We're not going to worry about it. Anyway, the only thing it shows up from what I've taught you now is that this person there's any should I say HLA antigen specifically, antibody, identify here. Do you get the point? Okay.
Yes.
Now let's ignore that and take this. So forget about your question. I'll show you how the answer will appear. Okay.
Yes.
So at this point, we are going to be looking at, so take this as a panel, also take this as a panel. Are you getting me? Okay.
Yes.
You know when I say first line panel and second line panel, are you getting me? Okay.
Yes.
So let's go on. So if you look at this, D is here, positive, right?
Yes.
But here it is negative.
Negative.
Okay. So we know it cannot be D.
Yes.
Cancel it. I want Okay, it's not even this one that you're asking me questions.
It's the second part.
Let's continue anyway. So you now come here, we'll continue with the same thing. So when you are giving these things, where I want your eyes to go, you see these places that, just 1 minute. If this place that it is 0, don't worry about it. Just go where it is positive and check. Okay. So now I'll quickly check. It is positive on cell 2 here with big C, but here it is negative. Now I need to check this big C. See, small c is negative. That means this is homozygous antibody. I'll cancel it here. Then we come to E, is positive here, and is positive there. It's positive here, and it is positive there. So it seems like there's nothing I can do about it. Am I correct?
Yes.
From what I've told you. Okay, good. So we now come to little c. Again, it seems like there's nothing I can do because it's positive here. Here that is negative. It's negative. I get it. So it seems like there's nothing I can do. Okay. Yeah. So let's go to little e. So little e, it seems like I can cancel it on cell number 2 because it's positive here and big E is what? Negative, right? So I'll cancel here. Then I'll come to M. M is positive on cell 3, but here is negative, right? I'll cancel M here. 2 is positive on cell 2, and the result is negative, right?
Yes, sir.
I cancel here. Okay. Then I come to S. Big S is positive on cell 3. The result of the patient is negative. And small s is negative, meaning that it is homozygous. I'll cancel. Then cell number 2, small s is positive, big S is negative, meaning small s is homozygous. I cancel here. Does that make sense? Yeah. And P1 is on its own, so I can cancel here. Does that make sense? Okay? Yeah. Then look at this LUEA and LUEB. Look at this. So it's heterozygous. Are you following me?
Yes, position 3.
So we can't cancel it. But just stay with me. There's something I'll teach you. Oh, God. But what is important is that when we come to LUEB, on cell number 2 is positive and LUEA is negative, right? And the patient result is negative. So we can cancel LUEB here. Do you understand me?
Yes.
Forget about here now. This is actually what I'm going to teach you. But forget that. So when you come here, if you're focusing on here, you can cancel 2 of them. But look at cell number 2. You have cancelled, but you are not able to cancel LUEA, by the way. But I'll tell you what to do. Just stay with me. I'll continue. So let us ignore that for now. Okay. So now we now come to K. Here you can't. Here you can't. Are you getting me?
Yes.
You come to small k. You can easily cancel it on cell number 2. You come to FYA. You can cancel on cell number 2. I'm sure you understand. Yes. You come to FYB. You can cancel here. Easy. You come to JK, you can cancel here, easy. You come to JKB, you can cancel here, easy. Stay with me now. So what it means that we are left with this? Are you following?
Yes, sir.
We are left with this. We are left with this. For what I taught you.
And K.
Sorry, I forgot K. Sorry, I forgot K. Isn't it?
Yes. Sir.
So now, what happened is this. We cannot exclude, at this point, we cannot exclude any of this, but there is something that is constant. Stay with me. What is constant is that when we look at this antibody panel, just 1 minute. Let me pick this so they can see. When we look at this pattern,
yes,
that pattern we are looking at matches this. You can't deny it.
Yes.
So from there, one thing we are very sure now is that this person is an antibody. Forget about any other thing you want to say. Any other thing you want to say is on the basis of the fact that you cannot exclude it.
Exclude it.
Do you understand?
Yes, sir.
Scale. Now let me show you another scale that I don't even know whether it is right, but it's a scale. Let me show you another scale. The another scale I want to show you is this. See, we know that LUEA, we cannot because it is heterozygous.
Yes.
But for the fact we have excluded LUEB, that means that thing we are worried about is not present.
Okay.
Are you following me?
Yes.
Because the reason why we cannot exclude LUEA here is the fact we are worried of the possibility of what? Heterozygous what? Antibody. But for the fact on that same panel we are able to exclude LUEB, that means it's not LUEB. And if it is not LUEB, therefore it cannot be LUEA. Are you following me?
Yes, sir.
We've excluded this one. Our biggest problem now is E and K. We are very sure that this person is antibody little c. That's the answer. Any other thing somebody is telling you is can't exclude. Do you understand me? Because it matches it. It matches. If it is two antibody, if it is two antibody, it should also, there's a way you can work it out. But for now, this is what it means. So if I'm going to answer this question, I will say that this person is antibody little c, can't exclude K and the big E. That's the answer. You can't say that there is big E. There's no evidence. You cannot also that it's big K. There's no evidence. Is that the fact that you cannot what exclude it? Are you getting me?
Yes, sir.
If you want to do another panel, like I told people many times, don't know if they understand it on my video, but let me see, hopefully you will understand. At the moment, because what we have, what we are querying now, we actually know that it is little c, by the way. Are you getting me?
Yes.
What we are querying now is E and K. Are you getting me?
Yes, sir.
Let us assume we want to include little c. These three now, if you want to do second line panel, are what you need to focus. You need to forget about the rest. Do you understand me?
Yes.
You focus on this. So the mistake people make if they don't understand, when they go to the second line panel, they want to start comparing every other thing. No, stay with that three that is left. Do you get the point?
Yes, sir.
Good. So, but this antibody is antibody little c and can't exclude big E and K. That's the answer to this question.
Thank you,
We
sir.
could have a second, can't exclude LUEA. We can actually say that, but with the skill I've told you, see how I've excluded it.
Yes.
Now, question. If we really want to, because these three antibodies are very important. They are clinically significant. As a matter of fact, a woman within childbearing age, we don't want the woman to develop antibody K. So we are very careful. So what do you think we can do next if you have listened to my part 4?
We do phenotype.
All right, we're going to do phenotype. When we do the phenotype, like I told you, that these IgG antigens are expressed on the surface of the red blood cells. This was why I was trying to explain to you antigen and antibody. That when we see antibody, it means the person does not have the antigen.
Yes.
So this antibody little c we are seeing here, it means for the fact the auto is negative. If you do this patient little c phenotype, it's going to be negative. Are you following me?
Yes, sir.
So that means the person does not have antigen little c, and that was why the person developed antibody little c. So when you do phenotype, the whole essence of doing antibody is to find out the antigen the person doesn't have. If the reason why you are finding the antigen the person doesn't have is so that when you are giving the person blood, which I should have showed you, is not on this video. You know that in the blood bag, we write what is negative. Have you ever seen our blood bag?
No.
Okay, I will need to show you towards the end. Just remind me if I forget. So the point is that, you know, while we are here, I need to really show you here. I don't want us to. We can't progress. I need to show you here. I'm saying that when you look at our blood bag, you can see that we don't phenotype. This is D negative. This is C negative. Are you getting me?
Yes.
If you look at this place, we even went as far. You can see this negative. This is K negative, S negative, CW negative. You can see it.
Yeah.
Are you following me?
Yes, sir.
This is big E negative. Look at small c. It's positive.
Yes,
So I'm sure you understand. This is messed up now. But you understand what I mean?
Yes, sir.
So what I'm trying to say in effect is that when we want to give blood, we now need to come back here and ask ourselves, which antibody, just 1 minute. Let me do, because I want to do this well. So you see now, this E is, so this person that is little c positive can never be that our patient, because that our patient has antibody little c. So this person that is little c positive, let's say that person was O negative, for example. I'm just making an example. And that person, this our patient now that was selected little c. Are you getting me?
Yes.
Let's say that our patient was O negative, and the person came, we gave this person this blood that we are looking at now. Are you getting me?
Yes, sir.
And because this blood has antigen little c positive, and that our patient was antigen little c what? Negative. That's why that our patient developed what? antibody little c. Does that make sense?
Yeah.
I'm trying to say that on our blood bag, we will tell you the antigen that are positive. Are you getting me? And in some cases, the antibody that are what? Positive. We'll show you the antigen negative. We'll show you the antibody that are what? Sorry, we'll show you the antigen negative and the antigen that are also what? Positive. Do you get the point? You can see that this is little e. Little e here is also what? Positive. Are you following what I'm saying?
Yes, sir.
So let's go back to that this thing, because that will now make sense what I want to say. Okay. So I'm saying that this patient now, if we want to go and give him blood or her blood, we need to now go and select blood that is antigen negative. That was why I showed you that blood bag.
Yes.
So we go to our fridge and be looking for the blood that is what? Typed as what? Antigen little c what? Negative. Then we'll do a cross match. Are you following me? So
Yes,
now
sir.
let's go back to why I said that. So when we do phenotype, that blood bag I showed you, they didn't do antibody. What they did was phenotype.
Wow.
So when we do the phenotype, for the fact that the phenotype shows negative, it already showing us that if you give the person antigen, that antigen positive, the person will develop antibody. So what we do in blood bank, once we do phenotype and we identify those antigens that are negative, we avoid it in the future blood transfusion. Are you following me?
Yes, sir.
So the only thing phenotype can do here for us regarding these two antibodies now we have issue. So you know this big E and this A. The only thing phenotype can do for us is for us to double check, does the patient has the antigen or not? If the patient has the antigen, we are not worried because the person should not develop the antibody. However, if the person does not have the antigen, what we need to do that when we want to give the person blood, we just need to assume that we don't want the person to develop the antibody. If this person, you've done the phenotype and the person does not have antibody, if the person is antigen big E and antigen K, big K positive, you don't need to worry. But if you do it and it is any of them or both of them negative, even though the person has not developed the antibody, but it means that the person can, are you getting me? Develop the antibody. In order to avoid the person from developing the antibody, you now need to put a comment on the laboratory information management system that this patient is antigen big E and K what? Negative. Therefore, cross-match big E, big K, also little c negative blood in future blood transfusion. Do you understand me?
Yes.
That's the idea of phenotype. The phenotype may not tell you the antibody, but it will tell you the antigen to avoid, because once you know that the person doesn't have the antigen, it now helps you to know that, okay, if the person doesn't have the antigen, therefore, I should, in future blood cross-matching, are you getting me, avoid those antigens. Do you get the point? So any blood I'm going to give the person will be that antigen negative. If you don't have any question, I'll move to the next one.
Yes, please.
Right, let me clean this so that I can further explain something for you. So I forgot to mention, I got carried away. I didn't tell you what this means. The red blood cells are negatively charged. Are you getting me? So this has a sodium which is positively charged, and that helps to enhance what the reaction. So that's just what this list means. Okay. All right. That's by the way. Let's go on with the next one, which is the main problem for you. So let's pretend and do the same thing we did before. Don't move so fast. When we come to D, by the way, because this is enzyme, from what they said here, we cannot check this reaction on MNS and FYA and FYB. I hope you know.
Yes, because they are destroyed by enzyme.
Correct. So they are not part of what we are going to check here. When it comes to those ones, we need to stay with this place. Are you following me? Cool. So D now, we can cancel D here. Am I right? So I'm going to be fast. Just tell me if I'm right or wrong. So D on cell 3 positive. The result of the patient is negative, right?
Negative.
Correct. So we now come to little big C. Big C is positive on cell number 3. Little c, look at little c here, is negative. Can you see it? So it's homozygous. We'll cancel because the patient result is negative on cell 3, right? Okay. The problem now is that with big E, stay with me. With big E, on cell 4 is positive. Are you getting me?
Yes.
and the patient is positive. On cell 5 is positive and the patient is, what can we do? Now, remember, we cannot look at the other panel, which is now enzyme. Are you following me? Okay.
Yes.
So we now go to cell number 4. This enzyme is negative here at 37. Are you getting me? Okay.
Yes.
Depending on what you are looking at. Okay. So even if you check it on cell, let's make it easier for you. Even if you check it on cell number 5, it is negative here on cell number 5. Are you following me? Negative.
Yes, sir.
But we must check before we can exclude this big E. We must check little e. Are you following me? Huh?
Yeah.
So when we check little e here and here,
Homozygous.
it's homozygous, so we can exclude it here. Under here. Are you following me? Huh?
Yes, sir.
Then when we come to little c, we can't here. There's no way we can exclude it. Am I right? Yeah, we can't exclude it anyway. However, we can use enzyme as well. Are you following me? Huh?
Yeah.
Because it's not destroyed by enzyme. Are you following me? So when we come to cell number 4 or cell number 5, we can exclude. So we need to ask ourselves on cell number 5, what is big C? Big C is negative, so it's homozygous. We can exclude. Are you following me?
Sir, this enzyme has 37 and AHA. What's the difference?
I will come to that. Okay?
Right.
Let's solve the problem first. So, are you getting me? We exclude that. Are you following me? Now, we come to little e. The little e, we can exclude little e on cell number 3. But we must ask ourselves, what about big E? So look at it. Big E is negative. Can you see it?
Yes.
So we can exclude it here. Stay with me. We can exclude M here on cell number 3 because N is negative. It's homozygous. Yes. So we can exclude it here. Unfortunately, we cannot exclude N because we cannot even consider N in the enzyme. Are you following me?
Yeah.
Unfortunately. Then when we come to S, we cannot even exclude S on the cell number 3, unfortunately, because of this.
Yeah.
Are you following me? Okay, which was your question, by the way. So now, so at the moment, we cannot exclude N, we cannot exclude big S. Let's look at small s. We cannot also exclude small s, unfortunately. Are you following me?
Yes, sir.
Now we come to P1. We can exclude P1 on cell number. We can't even exclude, okay, when we look at the enzyme, we may exclude P1. Are you getting me? Maybe here, actually. Okay? Then we'll come to LUEA. We can exclude LUEA here on cell number 3 because it's positive and negative. LUEB is only positive here. When we look at it under the enzyme, we can exclude it. Are you following me?
Yes,
then we'll now come to K. We can't exclude K here. Even when we look at the enzyme, we can't. Okay? Now, when we now come to little k, on cell number 3, we can. And that is it, gone. Do you understand me?
Yes, sir.
Come to FYA. Unfortunately, there's no way we can exclude it. Okay?
Yes,
we come to FYB. Fortunately, we can exclude FYB here. Do you understand? Okay?
Yes.
You come to JK, you can exclude JK here. Okay? You come to JKB, you can't exclude JKB here. However, under the enzyme, it can be what? Excluded. Sorry, not here. Sorry. Whatever. We can exclude it here. So let me clean this one. Okay? So we can exclude it there. So now, with this now, we are left with, let me circle the one we are left with. We are left with N. We are left with big S. We are left with small s. Are you following me? We are left with big K. We are left with FYA. Okay? And that's what we are left with. So the question now is that which one is it? And this is why I want to talk to you. So now, let me show you something quickly. Because the problem we are having here now is the fact that they've done all the panel for us. So there's no other one except they are going to give us another one. So we must make our decision here. Are you following me? So now let's start with N. The problem we have now is that with this N now, remember I told you with this ones, we can't do anything here.
Yes.
Are you getting me? So let's check N. Let's see, when we look at N, we find out that, okay, on cell number 3, N is actually positive. So what can we do now? here. So we don't know what we're going to do. So we're going to leave it because there's no way we can. Why I say we don't know what to do that? On cell number 3, that place, the only place it is positive. Are you getting me? But one thing is certain. When you look at the reaction pattern, stay with me. You will see that this place was only negative on cell number 3. Are you following me?
Yes.
But look at N. In most places, it is negative here, which is consistent with the patient result. But look at here that it's also negative. This place that it is negative, M is positive. That means it has nothing to do with two of them. Are you getting me? So that means the reaction pattern didn't quite meet that. Comes here. Are you getting me? Is also negative here. Why the patient is showing positive? Am I right?
Yes, sir.
So based on the fact that the reaction pattern, that's what I'm telling you, that's a secret. Based on the fact that the reaction pattern, we've seen the reaction pattern now, you're looking at it.
Yes.
For the fact it didn't meet up with that, you can cancel it. Are you staying with me? It's no longer it's a scale, so we're no longer talking about heterozygote. Are you getting me? It's okay.
Just the reaction pattern.
It didn't meet up. And with any possible thing that could have caused a problem. So now let's come to big S. The same thing is applicable. Let me pick my this. Let's come to big S. So we now look at the big S. Big S is negative on cell 2, but this is positive. It is not consistent with the reaction pattern because even this place that it is negative, small s is what?
Positive.
It's positive. Are you getting me? So if it is actually big S, do you understand me?
Yeah.
And also, if it is actually, if it's actually big S, this should be what? Positive here. But because the reaction pattern didn't quite meet it, watch what I will do. This is where people get stuck. I will exclude this.
Because of the reaction pattern.
Yes. Stay with me. Now, we now come to small s. Just stay with me. When we come to small s, yes, on cell number 3 is positive. And you can justify that maybe it's heterozygous. But even with that, let us go a bit further. You look at this place on cell number 9 is negative. Can you see it?
Yes.
And the patient result is positive. Am I right?
Yes, sir.
I say it doesn't quite meet up. Just stay with me. I'm going to actually jump something I should have told you earlier. Okay? So we are left with K and FYA. Are you following me? Now,
yes,
see what you are going to see now. Because one thing that is certain here is that when we carry this K and come here, it matches it. Are you following me? This is actually antibody K is present. That is obvious one.
Yes.
Do you understand? So,
yes, sir.
So when we now look at this place, our problem is that, okay, in addition to antibody A, what else is here? Do you get the point?
Yeah.
Because obviously antibody, look at this now. Antibody A is there. Sorry, antibody K is there. So now let us check something, because if you go by what I've taught you, you will say that FYA, that was why I think I jumped it. I should have tell you what it is, then tell you how we can exclude other ones. FYA didn't also meet up the pattern because just 1 minute. Like here that it is negative, it's positive. Are you getting me? But let me show you something now. I want us to combine these two. Stay with me. We are going to combine the two, and the two is going to match this. So I want us to combine the reaction pattern of here plus the reaction pattern of here. Okay?
Yes, sir.
And two of them is going to match. Let me get my distance lesser pointer so that it will be easier for us. So here is positive. So what we want to do is to combine this. Are you following? With K. So what I said on S stand, but we'll come back to it later. This is actually the way I wanted. So what I wanted to say that this is antibody K and FYA, because I've worked it out first. This is antibody K and FYA. So how you are going to know that it is antibody K is the fact that if you look at the enzyme pick only antibody K.
Yes.
So anything that is destroyed that has to be either MNS or DUFI A or DUFI B. That's all. Okay. So what I want to say that let us combine these two together. The reaction pattern must match. So when it is two antibody, if you combine two of them together, where this one is positive and this one is negative, it will still be positive. It can only be negative where two of them are negative. Are you following me?
Yes.
Okay, good. I'm saying that when you come on cell number 3, Let me pick my destiny again. When you come to cell number 3, this is negative. Can you see it?
Yeah.
FYA is also negative. Do you understand me?
Mm.
That's why this is negative. Do you understand?
Mm-hmm.
When you come to cell number 11, big K is negative. Can you see it?
Yes.
FYA is also negative. That's why here is negative. If you look at that, if you look at something like M, even M, like I told you, is positive on cell 3. Why this is negative?
Yeah.
So we now know that it cannot be M. Do you understand the point?
Yes, sir.
Sorry, 1 minute. We now know that it can be M. Again, when we come to N, you will see that on cell number 10, N was what? Positive. Can you see it? And the result was negative. You can see it here. On cell number 11. Okay?
Yeah.
So we know it can be N. You come to on cell number 3. We know that we can say that maybe this is heterozygous. And also, let us not take our eyes from this number 11 to it's also heterozygous with big S and small s. But let us go straight to FYB first. We'll come back to those S first. We have done with M and N. If you come to FYB, you're going to see that on cell number 3 is positive. FYB is negative, is positive on cell number 3. Can you see it?
Yeah.
And the reaction here is negative. So it's already not FYB. So what we are left is it big S or small s or FYA or FYB? Why you will know that it is FYB is this. We'll come back to S. I'll tell you how we can roll out S. But for now, let me confirm this first. You are going to see on cell number 1, FYA is positive. That's why it's positive here. Are you getting me? On cell number 2, FYA is positive. That's why it's positive here. You can see it, right?
Yes, sir.
The result is negative on cell number 3 because FYA is negative and K as well is negative. Are you following me? On cell number 4, even though FYA is negative, K is positive. As you can see it here. And that was also peak in the enzyme. Can you see it? Then after that, when you come to cell number 5, FYA is positive. Even though K is negative, that's why it's still positive. On cell number 6, FYA is positive. Even though K is negative, it's still positive. Are you getting me?
Yes, sir.
Then on FYA, 7 is negative, but K is positive. Can you see it? And that is positive, and that was also peak in the enzyme. Now, if you look at from after cell number 7, from 8 to 11, K was what? Negative. Now, what is left now is FYA. So FYA is positive here on cell 8. FYA is positive on cell 9. FYA is positive on cell 10. And what is left now is cell 11, and it is negative. So when we combine FYA and K, you will see that where this one is negative, the other one was positive. Are you getting me?
Yes, sir.
So that is why you say that this person has antibody FYA and K. Do you get the point?
Yes, sir.
So how do we then exclude this? The problem of this exclusion, we could have gone with S now. We could have gone with, okay, you know, the way we did it with the other one. But there is a little bit issue we're having here. The issue we're having here is the fact that, one, having said that, you will see that even though they are heterozygous here, are you getting me?
Yeah.
We are not able to exclude any of them in these two. But one thing is very important, that when we look at the reaction pattern on cell 2 here, big S is negative. Are you following me?
Yes, sir.
And this one is positive. Do you understand me? And because of that reaction pattern, okay, that it didn't maintain on cell 2, we can exclude big S. Are you following me? And therefore, if there is no big S from what we've thought about,
that means there won't be small s.
Yes. So this person has FYA and K. Do you understand?
Yes, sir.
So what you need to understand in antibody panel is this. That's what I taught you all of those things. So when they do panel, we have panel 1, we have panel 2. Are you getting me? So basically, forget about this list now. This is 1 and this is 2. So, and that was why I told you that in antibody panel, what you do that if you are not able to, if you exclude and maybe 2 or 3 is left, you carry that 2 or 3 that is left into the next panel. Don't forget about the other ones you exclude. So that's what happens. So that's why if you go for interview or anything and they give you antibody panel, for the only reason why we cannot consider MZI in MNS and DUFI A and B is because they are destroyed. But other ones, if you can't exclude it on this first line panel, you look at the second line panel. Does that make sense?
Yes, sir.
All right, so this person is antibody FYA and antibody K. Happy days. Now, when it comes to this 37 and AHG, my answer to that is this. All the antibody panel, we do them at 37 anyway. Are you getting me? But yes, but I don't know. This is suggesting to me as though one was done either at room temperature or cold temperature. Are you getting me? And one was done at 37. So because there are some antibody that are cold antibodies. So those ones that are cold antibody, we can do them under cold temperature. Does that make sense? Okay, or lesser temperature. That's the only thing I can say here. And again, another thing I can say here is the fact that because apart from that, whether you talk about here, there's no difference between this. Look at it now. This is AGH IgG. This is also AGH IgG, isn't it? So two of them are the same, and two of them must be done on what? 37 degrees. So in my own opinion, I still maintain that maybe if they're including this, it's either that this antibody are done at the room temperature and this one is done at 37 degrees. Does that make sense? So that 37 degree basically talk about the temperature of incubation. Are you getting me? But I would imagine if there is any different, they're supposed to specify it. If they didn't specify it, what I know about antibody panel is that it is always done at 37 degrees. However, there are some antibody that are cold antibody that you cannot see at 37.